China is gradually returning to normal, but without discarding all coronavirus prevention measures. Chinese authorities have reported 31 new cases of COVID-19, 24 of which were imported into the country. The Executive Secretary of the UN Economic Commission for Latin America and the Caribbean issued a call on Friday to the countries of the region to adopt universal, redistributive and solidarity-based policies in the midst of the novel coronavirus pandemic. In the midst of the COVID-19 crisis in the United States, the Trump administration is reinforcing its economic sanctions against Venezuela. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. The Chinese health authorities said on Friday it had received reports of 31 new confirmed COVID-19 cases in mainland China, of which 29 were imported. The two new domestic cases were reported in Liaoning and Guangdong provinces, according to the National Health Commission. 4 fatalities, all in Hubei province, were reported on the mainland on Thursday. Meanwhile, a county in central China's Henan province was placed on lockdown, with virtually all outbound movement of people banned, following several cases of coronavirus infection in the area. No one can travel out of Jia County without proper authorization. Additionally, residents are not allowed to leave their homes for work unless they have clearance to do so. Henan province reported 1 confirmed case in Lower City on Saturday. Local authorities said the infected person had been in contact with 2 doctors based in Jia County, who later tested positive for the virus, even though they had shown no symptoms. By the end of Thursday, China had reported a total of over 76,000 patients discharged after having recovered from the virus. Meanwhile, life is gradually returning to normal in 2 adjacent towns in central China's Hubei and Hunan provinces as the COVID-19 epidemic is gradually subsiding. Let's take a closer look.
A town in Hunan province, Shangde City, and a neighboring town in Hubei province, Yunzhou City, share the same name, Huangshantou, as they are located nearby the same mountain along the border of the 2 provinces. As things return to normal in the 2 towns, residents from Hunan's Huangshantou go to a barber shop in the neighboring town of Hubei every day. Meanwhile, a store selling maternity and baby goods has reopened in Hunan's Huangshantou, attracting both local customers and regular customers from Hubei.
About the cleaning, I would like it to be permanent and that we will be used to cleaning above all.
More than 10 Hubei farmers who breed crawfish in the town in Hunan were unable to take care of their ponds due to the restrictions in movement after the outbreak of the COVID-19 virus.
We are feeding them as much as we can and removing the moss in the field so that we can put the crawfish on the market at an early date when the market price is good.
Once they were able to return to the town, the farmers found their crawfish had survived, thanks to the help of a local resident.
The Japanese capital, Tokyo, is facing a difficult decision on whether to impose a lockdown, as its daily confirmed COVID-19 cases reached a new record of at least 95 on Thursday. Though Japan still has a relatively low number of confirmed cases compared to many other countries affected by the novel coronavirus, the rise in infection rate has sparked concern among Tokyo authorities. The number of confirmed cases in Tokyo went from some 100 to over 600 in 10 days, with over half of the infected patients aged under 40. Japan does not have established legal mechanisms to ban people from going out, which means a lockdown would be more of a request than an order. Meanwhile, the surge of coronavirus cases is also challenging the city's medical capacity, as over 500 of the 700 beds Tokyo has designated for COVID-19 patients are already full. And we now turn to the situation surrounding the COVID-19 pandemic in Latin America and the Caribbean. We begin in the Dominican Republic, where the distribution of a temporary subsidy as part of the stay-at-home program has begun that will benefit almost 900,000 households. The program is among the measures taken by the Dominican government to guarantee food supplies and alleviate the financial pressures on the most vulnerable families in the midst of the novel coronavirus outbreak. According to Vice President Margarita Cedeño, the stay-at-home initiative will provide 5,000 Dominican pesos, the equivalent of $93, in April and May to each beneficiary, transferred electronically. Authorities note that with this support, families will be able to purchase basic foodstuffs through the stores belonging to the social supply network. These stores scattered throughout the country offer products at fair prices. So far, the island has reported almost 1,500 COVID-19 cases and 68 deaths. The Executive Secretary of the UN Economic Commission for Latin America and the Caribbean issued a call on Friday to the countries of the region to adopt universal, redistributive and solidarity-based policies in the midst of the novel coronavirus pandemic. Alicia Bárcena stressed we are at the beginning of a profound recession and warned of the largest fall in growth that the region has ever seen due to the COVID-19 outbreak. In a video conference on the role of social development ministries and equivalent agencies with representatives of 13 Latin American countries, Bárcena stressed the negative economic effects of the pandemic in the region, particularly after 7 years of very low growth. ECLAP foresees a decrease of 1.8% in the Latin American and Caribbean area, which will directly affect employment, not only in the formal sector, but also for those who work in the informal labour market, who represent more than 53% of the total labour force. The Secretary-General called for universal access to COVID-19 screening and medical care. The UN agency also called to maintain universal access to basic services and to support vulnerable sectors of the population that are more likely to fall into poverty. The Presidential Commission for the Defense of Venezuela has denounced a series of threats by the United States government against the territorial integrity and sovereignty of the country in the midst of the battle against the COVID-19 virus. Tarek El Assami, Vice President for the Economy, stressed that through this plan, the United States is preventing the supply of chemical additives, supplies and replacement parts necessary for the production of fuel at a national level.
Facing this new aggression, the activation of a special fuel supply plan has been decreed, aimed at guaranteeing the mobility of prioritized sectors in the framework of the state of alarm declared by President Nicolás Maduro to counter the coronavirus pandemic, and which are exempt from the collective quarantine.
The Puerto Rico Health Department has reported 62 new positive cases of COVID-19, taking the overall tally to over 370. The island has reported 15 deaths due to the novel coronavirus. The latest fatality was a 41-year-old man, the youngest person to be killed in the country. Meanwhile, the Bahamas reported its first COVID-19 death this week, while the Prime Minister revealed 6 new confirmed cases, bringing the total to 21. Over the last week, the Caribbean region has reported an increase in the number of COVID-19 cases. So far, Martinique and Trinidad and Tobago are among the worst affected nations in the area, with 138 and 97 confirmed cases respectively. The Brazilian Association of Lawyers for Democracy has filed a complaint against President Jair Bolsonaro before the International Court of Justice in The Hague due to his misconduct over the coronavirus crisis. The association says President Bolsonaro's attitude is absolutely reckless and irresponsible, exposing Brazilians to risk due to a lack of concrete measures to curb the spread of the virus. On Friday, Bolsonaro said that Brazilian society will not be able to withstand 2 or 3 months of lockdown to contain the novel coronavirus, denouncing social distancing measures enforced by local states and municipalities across the country. Brazil has reported over 8,000 positive COVID-19 cases and over 330 fatalities. Meanwhile, the Latin American region continues to record an increase in confirmed COVID-19 cases. As of Friday, Chile has over 3,700 cases and has reported 22 deaths due to the novel coronavirus. Ecuador follows with over 3,100 infected patients, while the number of deaths reported reached 120. However, President Lenin Moreno admitted on Thursday that Ecuador's official data is far from representing the real numbers in the country. In the meantime, Mexico has reported 1,500 cases and 50 deaths. Panama's health ministry said on Thursday it had registered 1,475 coronavirus cases and 5 more deaths, bringing the total number to 37. Panama, along with Peru, started to impose stricter limits on how often people can leave their homes on Thursday in a bid to slow the spread of the coronavirus. Peru now has over 1,400 COVID-19 cases and has confirmed 55 fatalities. More stories coming up after this short break, so stay put. Welcome back to From the South. The United States has become the first country in the world to report more than 1,000 COVID-19 fatalities in a single day. According to data from Johns Hopkins University, the US has confirmed 245,442 cases so far. Meanwhile, the total number of COVID-19 deaths rose to 6,098, while the number of recovered patients is now 10,411. New York State has the largest number of cases, and its healthcare system is on the brink of collapse. According to Governor Andrew Cuomo, the virus is more powerful and more dangerous than expected. A total of 205 countries and regions have now reported COVID-19 cases. And New York City hospitals are now storing the bodies of coronavirus victims in street trailers, as the death toll in the city has reached close to 3,000. Bodies are being loaded onto refrigerated morgue trucks outside overwhelmed hospitals in full view of passing motorists. Russian media reported on Friday that ventilators donated to the United States to help treat COVID-19 patients were manufactured by a Russian company that is subject to US sanctions. A Russian military plane carrying the ventilators landed in New York on Wednesday after US President Donald Trump and his Russian counterpart Vladimir Putin spoke by phone. Russian state television footage showed boxes of Avent M ventilators, which are produced by the Ural Instrument Engineering plant. This Russian firm is part of the Concern Radio Electronic Technologies holding company, which has been under US sanctions since July 2014, with US firms and nationals banned from doing business with it. Trump described the Russian shipment as containing a lot of medical high-quality stuff, which could save a lot of lives, and said he'd take it every day if he had the opportunity, obviously unaware of the irony. The United States began imposing economic sanctions on Russia in 2014. Moscow denounced on Friday that the US, UK and the EU, among other countries, rejected the Russian motion to the UN calling for unilateral sanctions to be lifted in the midst of the fight against COVID-19. Moscow's permanent mission to the UN issued a statement on Thursday questioning why Ukraine, Georgia, the UK, US and EU had shot down its proposal, arguing that these nations refused to cast aside politicised approaches and interests, and that their decision could negatively affect a great number of people, especially in developing nations currently under sanctions. The Russian motion called for the rejection of trade wars and unilateral sanctions adopted without the mandate of the UN Security Council in order to ensure early access to food and medication. The motion was co-sponsored by 28 UN member states. The British Army has been drafted in to support the National Health Service this week as medical staff continue to battle the novel coronavirus. 20,000 military staff are on standby as part of the COVID-19 support force, delivering personal protection equipment and ventilators to hospitals. But many medical staff have claimed the response comes too late and that they are currently working without adequate protection, putting them at high risk of contracting the virus and passing it on to their patients. As hospitals brace for an expected rise in critically ill patients when the pandemic reaches its peak across the United Kingdom, they stress they are risking their lives because they haven't been equipped with adequate protective gear. The UK coronavirus death toll has risen to 3,605 and over 38,000 people have tested positive so far.
That I would be short of a surgical mask in this country. I never thought that in my wildest dreams that we would be feeling consistently unsafe as doctors. And some of my colleagues have even picked up life insurance in the last few weeks because they're that concerned. And unfortunately, I think it's the government have to take square responsibility for this, because you should never be putting your healthcare workers in a situation where we are scared for our lives.
The head of the EU Commission apologised to Italy for the limited response to the coronavirus pandemic, pledging €100 billion to help the country. But help may never come. Today, Europe is mobilising alongside Italy. Unfortunately, this has not always been the case, Ursula von der Leyen wrote in a letter published on Thursday by an Italian newspaper. She recognised that in the early days of the crisis, too many nations thought only of their own problems. However, after apologising for the lack of action, the EU Commission President proceeded to praise the aid provided to Italy by members of the bloc. Meanwhile, she announced that the EU is suspending import tariffs and taxes on medical equipment needed to fight the coronavirus pandemic.
We're working on all fronts against coronavirus. This is an emergency situation that requires extraordinary action. Our hospitals, doctors and nurses need medical equipment such as ventilators or testing kits, to treat patients and save lives. And they need equipment, masks, gloves, overalls, to protect themselves from contamination. We need a lot of this equipment, and it can be expensive. And that is why today we accepted to eliminate for a while certain taxes on the import of medical devices and equipment from countries that are outside the European Union. This is good for hospitals and for charities, for example. This is our contribution to easing the pressure on prices for medical and protective equipment and to making them more affordable.
We're taking one last break now, but stay with us for more. Welcome back to From the South. German authorities have donated 50 much-needed ventilators to support the Spanish healthcare system during the coronavirus pandemic. The donation was flown into Madrid early Friday morning by 2 Spanish Air Force planes. The Spanish health system has a desperate need for ventilators to assist patients in intensive care units. During the Health Ministry's daily briefing on the coronavirus in Madrid, Dr. Maria José Sierra noted that there is a trend of reduction in the number of cases being reported and in the amount of people being hospitalized. She explained that as of Friday, a total of 10,935 people have died in Spain since the beginning of the epidemic, including over 900 just yesterday. On the other hand, the total number of people discharged from hospital has reached over 30,000, representing 26% of the total number of confirmed cases. While social media has been widely blamed for spreading dangerous misinformation on the coronavirus, tens of thousands of Australians are using their networks to support the healthcare workers risking their lives on the front lines of the epidemic. Community groups are also packing and delivering meals to medical workers and those in isolation. Australia has so far reported over 5,000 confirmed cases and 28 deaths.
To hospitals for a bit of morale boost. People have been helping out with doing grocery drops to intensive care nurses, and it seems to be working really well. And it's booming. The group is growing so quickly. 19 tests that we can't help them do their jobs because we are not skilled, but I can do their grocery shopping for them, and I can offer to babysit my brother's kid when he has to pick up an extra shift or something like that. So it's about helping with the practical side of life for our healthcare workers who are on the front line against this thing.
The Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, has stressed that countries should try to ease the burden on their populations by removing financial barriers to care in the response to the coronavirus pandemic. He also noted that there are now 1 million confirmed COVID-19 cases across the world and more than 50,000 people have lost their lives.
Several countries are suspending user fees and providing free testing and care for COVID-19, regardless of a person's insurance, citizenship, or residence status. We encourage these measures. This is an unprecedented crisis which demands an unprecedented response. Suspending user fees should be supported with measures to compensate providers for the loss of revenues. Government should also consider using cash transfers to the most vulnerable households to overcome barriers to access. This may be particularly important for refugees, internally displaced persons, migrants, and the homeless.
Malawi announced on Thursday its first 3 coronavirus cases as one of the last African countries to report the potentially deadly disease. The southern African nation was one of the few without any confirmed cases, alongside the Comoros, Lesotho, Sao Tome and Principe, and South Sudan. President Peter Mutharika said the patients were located in the capital, Lilongwe. He noted that the government would provide medical care for the 3 patients and track down their immediate contacts. There are now over 7,000 confirmed novel coronavirus cases across the African continent. According to the latest data from the Africa Centers for Disease Control, there has been a rise in cases and only 4 countries are still holding out. So far, 290 deaths have been reported and over 600 patients have recovered. Iran is battling the most severe coronavirus outbreak in the Middle East. The country reported the death of 134 Iranians over the past 24 hours, which has taken the death toll to almost 3,300.
2,715 new confirmed cases of COVID-19 have been reported across the country over the past 24 hours. And with those 2,715 cases included, we have so far over 53,138 cases of COVID-19.
Even with its members scattered far and wide by the coronavirus lockdown, the National Orchestra France has still managed to come together to make music with the help of modern technology. Its musicians recorded themselves playing bolero in their homes, and the sounds were stitched together into a seamless whole, with a video posted on YouTube. As we come to the end of this news brief, we offer you a glimpse of this music in times of coronavirus. Don't forget to follow us on Facebook, Twitter and Instagram, as well as on YouTube. For Telesur English, I'm Katrina Goss. Thank you for watching and enjoy the music.
Marc Donat.
Je suis Louise.
Dominique Desjardins.
Muriel Gallien.
Émilie Gasto.
Elodie. Alice.
Je suis Mathilde Lebel.
Didier Benetti.
For me and for all the musicians, I think, make music is to share music with the others.